Hello viewers, my name is Kariuki. I am a wife and a mother of 2 daughters. Professionally, I am a counseling psychologist. Previously, on this program, we looked at loss of a loved one. Today, we are going to look at miscarriages and stillbirths. Ladies out there, you can hear me. There are some of us who have gone through loss through a miscarriage or a stillbirth. This is where the mother has conceived, has looked forward to getting a baby who will be at term, in most cases 9 months. But something happens on the way during the pregnancy. It may be a sickness, it may be a particular condition, or a contributing factor that may not be known. But that brings an end to the pregnancy prematurely. This, to the mother, to the lady out there, this becomes a major loss. One is looking forward to bringing out a bouncing baby boy or girl, or some of the ladies may have stayed for so long waiting for a baby. That may be one scenario. They have waited to get a baby for a very long time. Then it happens that instead of getting a live baby, a miscarriage happens on the way. Or the baby, probably just before the baby is born but dead, what we call stillbirths. The mother doesn't have to have waited for a long time without getting a baby. The mother may have just conceived at their right time, but this baby does not get to the world alive. Many times we look at that in the community, in the society, like it was an unborn child. It was a fetus, as people would call it. It was a stillbirth. But to this lady, you who is hearing me, you who is listening to this program, you who is watching, you who has a friend who has lost a baby through miscarriage or being a stillbirth, you know that it is a loss. And we cannot move away from that and saying it is because it's a baby. No, it is a loss. Some parents, some mothers, some families may have even gone shopping and prepared a room for the upcoming baby. And they keep on saying, we are expectant. If it's one parent, you say, I am expectant. If there are 2 parents, they will say, we are expecting a baby. Technology these days is there. They might even have gone for a scan and they know it's a baby boy or a baby girl. Or they have multiple babies, like twins and the like. But now, when it comes to the end, they find that what they had actually planned for, and they intentionally prepared for, is not what they expected. And that's how the room they had prepared, their expectation becomes such emotional because it is a loss. I one time was working with a friend who lost a baby. The baby was born, but was born dead. So as we used to work with her, people would ask her, those who had seen her pregnant, they were asking her, did you get a baby girl or a baby boy? And that is the time I learned how painful it is because of the expression of my friend. She would not have words to say. And I would see her bed, I would see her, look down, and I would see her really feel the pain. And for me, I would just be with her. I'm talking to you as a lady, as a family, that have lost a baby through miscarriage or is a stillbirth. It is a pain that you have gone through. And that is what I said earlier on, that this pain, we'll be looking at it when we are looking at grief, because it is an area that this family, this lady, this mother need to be supported and somebody to walk with them. And that is the essence of this program, that we are able to walk with you, with other mental health professionals and with other professional health workers, that we can be able to walk with you and support you so that you deal with those issues. You deal with the emotions. You walk the journey with support. And I would like to hear your experience of a birth or a baby that was either born dead or it was a miscarriage. What did people tell you? What did people say about it? What are some of the questions they were asking you? What are some of the things they were telling you? And that is what I would like you to share with me. And as we go along, we'll be able, as I have said, share with you some of the ways that you can deal with these losses. Please get in touch with us on +254 114 404 200. And we'll be more than glad to walk with you, even as you walk in this journey of the loss. Because remember, it is a loss. Remember, it is a loss. Thank you so much for watching. Stay tuned for our next episode. Thank you.